Okay, so here's kind of our outline for today. We're going to talk kind of advanced surgical guide topics. We're going to start off with scan appliances. So we're going to review that. I know we reviewed that last year for guys that were here, but I'm going to go back. What is a scan appliance? And then how do we bring that into like full arch or just even simple overdenture surgeries? So just a simple 2-locator implant, bread and butter type of surgery. How can we kind of bring the digital aspect into that surgery and make it really predictable? Talk a lot more about like implications for guided immediates. So that's a big hot topic with a lot of guys. It's like they want to put the implant in at the time of extraction. So what do we need to be thinking about when we have an open socket, whether it's a single root or a multi-rooted tooth? Like what thought process do we need to have in our mind when we're going to use a guided approach to put an implant into that area? And we're going to talk about some of the ramifications there. This is a really big one. Like, how do we remove that tooth from the model? How do you digitally extract a tooth? That's probably one of the most common things I get. Docs want to plan an immediate guided surgery and they scan the patient and the tooth's still sitting there. And it's like, how do you get the tooth off the model, digitally extract it so that you can plan a guide that takes that into account? So we're gonna make sure that you guys leave knowing how to do that. That's a really important topic. Guided internal sinus lifts. I'm just going to go briefly over the kit, the Blue Sky kit. Dr. B is going to talk about the following 4 topics here. Managing your crustal bone with profiling kits, flaps, a concept called zero bone loss, and then the timing. He'll go over what guided implant timing is. And then a little bit more after lunch, we're going to start talking about the prosthetic side. So how do we print prosthetics, both temporary and finals, and how do we have them maybe printed before the surgery so the implant goes in and the tooth just gets screwed right in rather than the typical conversion that happens chairside? How do we make the temps look good? Going back, kind of understanding some of just the restorative side of dentistry. What's a tie base versus a custom abutment? What's a scan body? What do we recommend using? How do you do a chairside pickup for an immediate load temporary on an implant? That's an important topic for patients that want to leave. I mean, central incisor nowadays, like people don't really love flippers. So if you can give them an immediate implant, you can put a tooth on it that same day. It's a great service. Scanning on surgery dates. So how can we be more efficient? How can we cut down on appointment time, patient visits? So some little tricks that you can do as far as scanning like on surgery date to cut out a couple steps. 3D printed final restorations, custom impression copings. How do you create custom emergence profiles and tissue designs, and how do you transfer that to the lab? And then touch briefly on the exocad app. So a lot of stuff to cover today, plus we got to do like 3 or 4 hands-on cases, so we got a big day ahead of us. Any questions for anybody? And you guys just jump in, raise your hand. Small group, let's just keep this conversational. So just raise your hand or shout out if you guys have any questions. We need Brady in here. Brady's always like the one like shouting out, asking good questions. Yeah, we're missing Brady. Just a little bit of review. This is a lot more in the first course, but we talk about how do we get this data? How do we get our intraoral scans and our CBCT and get them stitched up? We don't have time to go over all the basics, but that's obviously fundamentals. If you guys don't know that stuff, you got to go through course number 1 because this stuff will just be too far ahead in the process. Make sure, we talked about photography in the first course. Use your photography for planning your teeth positions when you're changing vertical or doing a full mouth case. Let's keep going here. And then again, this is all the basics that we went over in the first course. When to use guided surgery, what guided surgery is not. We go through the different modules. When to use a fully guided approach versus maybe a pilot approach. And the big thing is really learning some of this terminology called offset. This is probably the biggest question that I get is like, how do you change the offset from the implant body to the top of the guide tube, and why and when? And we're going to touch on that a little bit today, but we don't have quite the time to go in depth. But that's a concept that you have to nail because that's probably the biggest question. How do I remove teeth off a model, and how do I change the offset of the guide tube? So you got to know that stuff. The output is really, getting the file out of the system and into the real world. So in our world, we're just printing. We're doing a lot of printing, and we'll outsource the milling of things, but printing is really the future. We have Sprint right here on the first course, and they show their products. So we're not going to spend a lot of time on that today because, again, that was kind of course number 1.